Hi, my name is Giovanni Jacobs, and welcome to my project proposal video. My topic for this project proposal is how to make Family Time Crisis and Counseling Agency more accessible to disabled domestic abuse survivors. I chose this topic because I want to improve services at this agency for one of Houston's most vulnerable populations. The main question that I'm aiming to answer for this project, or one of the main questions, so how are we doing? Are we doing enough for disabled victims of domestic violence? Are they able to access the necessary services at this agency? But first, let's get some background on the agency itself. Family Time Crisis and Counseling Center specializes in services and programs that encourage the mental health and wellness of the community and promote safety and support for the prevention of domestic and sexual violence. Key services include counseling, case management, assistance with legal matters, and shelter from an abusive situation. This proposal intends to increase women with disabilities access to domestic violence and sexual assault services, which I understand to be an underserved group. Women with disabilities are more likely to be victims of domestic violence or sexual assault, but they also have a lower likelihood of receiving help. I am proposing that Family Time collaborate with other local organizations specializing in public health, clinical practice, research, and disability concerns. Family Time can also collect statistics about the quality of life of disabled individuals, accessibility requirements, and the Americans with Disabilities Act. It was essential for me for this proposal to think about what Family Time needs to do to improve access. What have they already done? What needs to be done and what hasn't been done. This also brings to mind about what we can do overall to help our disabled clients. What are the most significant contributors to inadequate access? So here are my goals for this project. Family Time Crisis and Counseling Center are being pushed to implement better methods to help disabled survivors of domestic violence and abuse. The ultimate goal is for more women with disabilities who have experienced domestic abuse or assault to access appropriate services and treatment. So here's just a breakdown of the demographics that Family Times tends to see. So 19% of clients will have PTSD, and that usually stems from the trauma they've experienced regarding their abuse. 19% suffer from substance abuse, being on the street, not having really anywhere to go, and kind of keep going back to destructive habits because they've come from destructive situations. 29% have physical disabilities. From what I understand from my research into the clients, some of these disabilities are temporary and again stems from the abuse that they've suffered, but some of it isn't. And so it's long-term. You're talking about long-term disabilities on top of the physical and mental trauma of being abused. And then 33% have mental illness or struggle with mental illness. So here are my primary objectives for this proposal. By May of this year, 90% of employees at the agency will have been taught how to use TTY, a deaf-friendly means of communication designed for persons who have trouble hearing or speaking. By December, the agency's accessibility will be enhanced by the erection of a wheelchair ramp. Right now, the counseling site that I'm doing my field service at, there's no wheelchair ramp, which is, really unfortunate because there is one at the shelter. But if I'm at the shelter and I want to seek counseling services, which a lot of them do, and I'm wheelchair bound, and I come to the counseling site, there's no access for me. And I think that's really discouraging. If I were the client, I would feel really discouraged. And, I could pop a wheelie and get up on the curb, but it's not, you're setting the wrong tone, I believe, from the beginning with the client by not having better access for them to just enter the building, better means for them. So that would be, that one's very important to me to get fixed for the agency. By June 2023, next year, disabled women may have better access to agency information, printed materials, the hotline, intake, paperwork, the website. That means the handouts that we do when we go to outreach programs or outreach events in the community, brochures, flyers. Maybe that information will have Braille and it's we already definitely have it in other languages, but maybe there'll be somehow we can have an option for people that are blind. The website will also become more inclusive. And then the next objective is to add to the budget by employing a sign language interpreting service or interpreter by next year. So a year to plan for that. Exactly how will we accomplish these goals? So here are my action plans to move this project forward successfully. Strategy 1, to guarantee that deaf survivors have equal access to services, provide TTY training to all staff members. Strategy 2, collaborate with the organization Texas Ramp Project to secure the donation of a wheelchair ramp to the agency. This one I'm particularly excited about because Texas Ramp Project does great work for all of Texas, and it's donation based and it's referred based. So, Family Time will have to work with getting the referral to be picked for this donation, but it's a process and it can be done. And I believe once they know what the clients that this agency is serving, that it would be approved and would be become beneficiaries to this wheelchair ramp, and it would be of no cost to the agency and no cost. You wouldn't have to use donation funds, and it would just be a great opportunity. So I think this one would be really, really exciting and a great opportunity. Strategy 3, work with web design company Zag Interactive to create ADA compliant web and print content. Zag Interactive, they distinctly work with making sure web content, brochures, flyers are all centered or can help attract or better serve disabled clientele with web information and print information. And I just think that's really interesting to work with a company that already knows that that's what they mainly work. They work in that environment and can give us a better resources on how we can help that particular clientele specifically. And then strategy 4, increase the budget by 15% to accommodate hiring of a sign language interpreter. I know a lot of businesses, a lot of agencies don't necessarily see there's a need, but I think any chance that you can miss one client that uses sign language and they are not able to use the service, I think that's unfortunate. And there should be an opportunity for at least a hiring of a social worker familiar with using sign language. So I think that would be really, really important and beneficial. So these won't be easy changes to implement. And along the way, we'll need to evaluate how successful things are proceeding. So I propose we do monthly check-ins. Month 1, the program coordinator will determine the proportion of personnel signed up for the TTY training. Month 2, the director of operations can inquire about the status of the ramp referral. Like, where are we on the list? Like, are we on their radar? Do they know who we are, what we're trying to accomplish at Family Time? For month 3, the administrative assistant will get a preliminary copy of agency's new brochures, flyers, and website, even though this goal isn't necessarily needed to be accomplished until next year. You know, it takes time to get approvals done and make sure that these documents fit exactly the message and vision of Family Time and what we represent to the community and to our clients. And in month 4, the CEO will be presented with further research on the significance of employing a sign language interpreter and why it would be beneficial for all of us to have access to that, knowing that we can refer our clients that are disabled in that arena, that we have someone at the agency would give, I know if I was a social worker there, a lot of confidence. And so I think that's just, it's something that our clients deserve. So what are we dealing with right now? So right now, domestic violence survivors with disabilities often endure several challenges as they overcome numerous hurdles, one of which is gaining fair access to social services. But I believe that if we implement some of these strategies and work on these goals, that the future, women with disabilities and their specific needs become part of a larger conversation about advocacy and equity. But first, we need to dismantle these barriers for seeking services. With proper training and additional resources, I believe Family Time can and will become that voice. The purpose of this proposal is to encourage Family Time and Counseling Center to become a more accessible refuge for disabled survivors of domestic abuse and their families. And I believe strongly that working through these goals step by step, we can accomplish that. So thank you so much for listening. I appreciate you and have a great day.